Each summer, I get concerned about West Nile virus since we've had the introduction of it to the United States about 1999. And we've had a number of cases in Kansas over the years. And certainly it's the middle of the summer when we really begin to have real problems with that. But usually we have the most problems when it's a very dry summer or a very warm winter before a dry summer. That's the best time to have the most West Nile. We'll have more mosquitoes in wet seasons like we have this year. But a cool wet season means that we have a longer time for the incubation period of the virus in the mosquitoes. So they don't transmit it as often. And there's not as much West Nile ordinarily. So I wouldn't predict this summer, unless it gets hot, that we'll have as much. Now, we had kind of a warm winter last winter, which would lend itself to saying we should have more. But now with all the rain we've had, that would lend itself to saying we should have less West Nile this year. So we'll see what the balance is. It's kind of a difficult balance because we don't know which will win out. That's where there's more likelihood of standing water, where there are puddles of water, pools of water that don't dry up, that sort of thing. Then there is likely to be more mosquito breeding in those areas, particularly if we're warm enough. If we're cool enough, we won't have much mosquito breeding even in those areas. But people who are outside are more likely to be exposed. But it's people who are outside from dusk to dawn that are really more likely to get exposed to it. And people that wear short sleeves when they're out at night, people that wear shorts instead of longer trousers are more at risk for it. People that don't use DEET or mosquito repellent of some sort are more at risk for getting it. So all that factors into who is likely to get it. Now, obviously for people who are likely to show signs of West Nile once they get exposed to it, those are people who are older. Those are people who are immunosuppressed. Those are people who are on steroids or have an immune problem. They are more likely to get into real difficulty with West Nile when that happens. West Nile, for a lot of people, if a person's young, they probably won't even experience much. They might have a little bit of fever, might have a little headache. In fact, it's classical to say that most people who get West Nile virus will get a febrile headache. Now, if a person's under age 50, the risk of getting disease once they get bitten by a mosquito that's carrying West Nile is maybe 1 in 300, 350. If a person's over age 65, a risk may be 1 in 50 of getting something. And so the person who's going to have, say, a febrile headache, maybe chills, maybe nausea, vomiting, aching, all that could be part of West Nile. Their eyes may hurt. People can get a lot more serious illness than that too. Many will, a smaller percentage, will get an encephalitis or a sort of a viral meningitis, or even some people will get polio. So we call it a polio-like illness, but really it's polio because it knocks out the anterior horn cells. So that they really do have flaccid paralysis. They can't move a leg or can't move an arm. I've seen a patient, for example, that was called stroke, sent in for stroke. Didn't have stroke, it had West Nile, was what the patient had. And we tumbled to that fact because the patient had headache and had fever along with her stroke. And that was a characteristic sign that this probably was more than just a regular stroke. In fact, if a person acquires it, they don't transmit it to another person because they didn't wash their hands. It's passed by mosquito. Now, it can be passed by other ways too. If it can be spread in breast milk. It can be spread to a newborn baby if a mother had it, for example. If a person is a blood donor, it can be transmitted in blood transfusion. If a person, God forbid, got killed, had a motorcycle accident, for example, got killed, and was a heart donor or a liver donor or a kidney donor, those organs could transmit it as well. And it happens regularly each year that somebody will acquire an organ that has the transmission of West Nile. There is no antiviral therapy that works for West Nile. There is no human immunization that works for West Nile. There is horse immunization. In fact, one of the ways that we know that there's more West Nile in the community is if there are more horses who are acquiring it. And the horses can have, they can look sick, they can have stumbling, they can have gait problems, they can sort of look dull. All those, and I'm told that people who love horses can tell when they look dull and they've got West Nile. And horses die from it and don't do well from it. Birds, in fact, have it. We don't tend to immunize birds, but birds can have it, particularly robins. Robins in the spring are the big carriers for it. and house sparrows in the fall are what the mosquitoes tend to be feeding on more often than the robins. So it's robins in the spring, sparrows in the fall, and that's a mechanism of transmission. But we see more crows and blackbirds, and blue jays that will die. They tend to die more often than, say, well, sparrows. Sparrows don't die from it very often, but blue jays, for example, those pretty bluebirds, will die if they get a West Nile. So if we see an increased number of blackbirds that are dying, increased number of bluebirds that are dying, we can suggest that that might, in fact, be due to West Nile. Well, if we're sleeping outside, we need to have some way to prevent the mosquitoes from biting us. So we'd use sprays, and if we didn't have screen wire, we'd want to make sure that the screens are intact so that the mosquitoes don't get into houses, for example. Or one of the other risk factors they found that if a person has flooding in the basement, there is a higher likelihood then of also having mosquitoes in the basement and having West Nile and acquiring West Nile. So if there is water in a person's basement, they need to be really careful that they don't have mosquitoes there and that they get rid of that water from the basement so they won't get West Nile. That's another risk factor. So yes, you're kind of right, except that obviously with most air conditioning that we have now and with good screen wire, when a person has the attic fan and has the windows open, if that's all intact, then the chances of a person acquiring it by the old time route is really minimal.